AM 1450, FM 99.3 KNSI. Welcome to Your Health, a brand new program on KNSI featuring local health experts from CentraCare. Now, I stress that word local because these are your neighbors. They're people that you see all the time. They're at your kids' schools, the grocery store. They live, they work here in central Minnesota. And that is important because they know firsthand about the health issues that affect you, because they are also impacted by those same factors. They just happen to be healthcare professionals at CentraCare. And our first guest is Jodi Gertken, Community Wellness Program Director. Jodi, great to see you.
Great to be here. Thank you.
What does that mean, Community Wellness Program Director? Are there some community wellness initiatives that are out there?
Yeah, absolutely. And I think we emphasize the community part. We, of course, at CentraCare have our own employee wellness program. As Central Minnesota's largest employer, we at CentraCare care very much about all of our employees. And so we are doing a lot to keep ourselves healthy. But likewise and equally as important is the well-being and health of our community. So we're looking at creative and innovative ways to partner with communities so that we can be one of the healthiest, vibrant places in the state.
Now, years ago, you and I talked about this thing called NuVal, right?
Yeah, yes.
And I think, how long ago was that?
Wow, that was back in 2011, 2012.
Okay, now I look back at that initiative, right? You went around to supermarkets, you found out that, again, we should shop around the outside of the store, the perimeter of the store.
That's right, yep.
But you went in and food products were labeled in ways that they had not been labeled before.
Right. I call this kind of the story of the butcher, the baker, and the candlestick maker.
Sure.
It was CentraCare, major health system, Coburn's grocery store, and Blue Cross Blue Shield of Minnesota. And the three came together to look at, again, innovative ways that we can make that healthy choice the easy choice for consumers right at the point of purchase. And at that time, NuVal LCC was a corporation out of Massachusetts, created by Dr. David Katz. Mm-hmm. And he had this algorithm that would rate food 1 to 100. The higher the score, the more nutritious the food. And we thought, well, how simple? Because regardless of your education level, even what language you speak, you can figure out that, say, 80 is more than 20, and you could trade up for better health. So we implemented that in all of the Coburn's grocery stores and a few of the Cashwise stores. And then we also implemented it in Sartell St. Stephen's schools. It was met with great success, again, because it was very easy, and you could look at making that really simple choice. Sadly, much to our, demise.
Chagrin.
Yes, chagrin, good. That corporation is no longer in business.
All right.
But that created this opportunity for us to work with Coburn's dietitians and CentraCare dietitians and say, okay, what could we do to continue this, make this easy? So Coburn's dietitians created a program called Dietitian's Choice. Oh. It was endorsed by our dietitians in CentraCare, and we don't endorse, as you can understand, a lot of things. So This was a big deal. So we really wanted to continue that relationship with another, major employer and business in our community. And again, continue to make that healthy choice easy for consumers.
And then there's got to be an app for just about everything these days, right? So that information, is it available in the palm of my hand?
Yeah. If you would go to the Coburn site, they've got it available right there. And it's, again, very simple, because I think a lot of times when you're trying to look at, if you pick up a loaf of bread, for instance, and you compare it to another loaf, well, this one's got 12 grains, well, this one's whole grain, this one's got this. They've made it very simple. And so they just look at it and say, and if you're into organic or some of these other things, these other elements, they have those listed as well.
Stay away from enriched. That's all I know, right? We're talking with Jodi Gertken, Community Wellness Program Director, and this program is called Your Health, folks. It's brand new, a nice collaboration between CentraCare and KNSI. It's all about you and your health. Jodi, you and I also talked about a program called Blend, Better Living Through Exercise and Nutrition Daily. I still remember.
You still do.
And it's still happening, isn't it?
Yes, we've actually taken Blend, which was our childhood obesity prevention initiative, as well as Crave the Change, which works to reduce tobacco's harm and does our tobacco prevention, and created Feeling Good Minnesota. So we are also looking at broad populations, not just specifically children, but, general families, the elderly population. And we've also incorporated ACEs, Adverse Childhood Experiences, and Trauma-Informed Care. So we're looking more broadly at how can we encompass all of this good work that we're doing through CentraCare and our community partners and put it under one umbrella. So that's Feeling Good Minnesota.
Is that what brought you to Care 11 and television fame?
My 15 minutes?
That's it.
Yeah, exactly. Yes, that was my 15 minutes of fame.
Well, no, because, I mean, we would see that show on television all the time.
Yeah, it was a great partnership that we had with Care 11 at the time, where we would go and do an episode once a month. I'd actually go down and do 3 of them in a day, which was kind of fun because we just change clothes and have new topics.
Right.
But then they would air, and the amount of recognition locally was profound. I would.
Were you surprised?
I was.
Yeah.
I was very surprised. I think as were my children.
Yeah.
But I would go to the grocery store and my phone would light up, and I'm like, oh, it must be the Saturday that Care 11 is on, because people were texting me. I just saw you on TV.
Right.
So it was nice that it was local, like this show, that we could talk about our local issues and things that are happening, and great solutions that we're working together on.
Well, with, again, local grocery stores.
Exactly.
Right? Very cool. Very cool. Now, when we talk about quote unquote healthy communities, and we all have our own initiatives at home that we are trying to do, how does that match up, community wise with everybody at home and their own things that we're all trying to do? It's pretty much the same thing, right? It's a broad umbrella. And if we just pay attention to some of the things that CentraCare is offering in community wellness, our job at home may be a lot easier.
Absolutely. And that's really what we want to do, Bob. We want to make sure that we're creating environments that everybody can benefit from. There's great resources in the community for, let's say, weight loss, tobacco cessation, resiliency, but you oftentimes have to opt into them and pay a fee for that. So we're looking at solutions about 10,000 feet higher and say, how can we impact whole communities and everybody benefits from that? And that could be, for instance, a lot of the municipalities we work with on safe routes to school. How do we make it easy for every child to have the opportunity that they could safely walk or bike to or from school? Still
be safe, but still getting exercise.
Exactly.
That's how it works. AM 1450, FM 99.3 KNSI. Again, folks, Jodi Gertken, our guest. She is the Community Wellness Program Director for CentraCare. This is Your Health. We'll be right back. AM 1450, FM 99.3, KNSI. We're back with our brand new program called Your Health, featuring local health experts from CentraCare. Jodi Gertken is the Community Wellness Program Director. And Jodi, when we talk about preventive health care, that's really where everything is going, isn't it?
Oh, absolutely. I think it's an ounce of prevention is worth a pound of cure. Exactly. And so that's not new news. That's been around for quite some time.
Right.
I think what's really unique about what we're doing at CentraCare is both what can we do from a preventative aspect individually, and then what is our responsibility as a healthcare system to keep our communities well through preventative efforts that affect everybody.
So is it more than just giving people the tools that they need to succeed?
Absolutely. We do that. I mean, we're looking at, your annual mammograms and colonoscopies and flu shots. And those are things that Bob is going to have to sign up and go do for Bob.
Right.
And that's great. And that's prevention. And again, we can't emphasize that enough. But likewise, I can tell you to go get a colonoscopy and you are therefore, quote, educated, but you still might not do it anyway.
Right.
So we want to make sure that in some of our preventative efforts where we are able to, we are making sure we're encompassing whole populations and communities. And so if we know that reducing exposure to secondhand smoke is going to benefit everyone, we're going to support things like the Freedom to Breathe Act, which passed in 2007.
As opposed to fear, it's education.
Yes.
Right?
Right.
Because you can scare the bejeepers out of everybody.
This is true. I've tried it with my own children, right? To know
education,
success.
Education is so much better, so much more effective.
And we like to look at education and programming that supports our policy efforts. So if we're going to educate kids to eat 5 or more servings of fruits and vegetables every day, we want to make sure that either in their school or in their communities, they have the ability to access those healthy foods. So it's partnering the two that go together, because that's where you really have the secret sauce and see the best success. My job at home is to make sure that the kids understand why it is so important. We're not just nagging you here. Absolutely. Right? Yep. So who have you folks partnered with at CentraCare to make these things come true? Oh, I wish I had another 20 minutes to list every community partner that we've worked with. But again, I think that's really where we've seen our greatest success and what makes the work that we do through CentraCare so special and so different. It's not just about CentraCare. It's about the whole collective sum of all of our partners. So we work with the Greater St. Cloud Development Corporation, the YMCA, Health Partners Clinics, Sartell Pediatrics, obviously Coburn's, who we've mentioned earlier. Everyone has some ownership in this. Mm-hmm. And whether that's the foods you offer, shoveling your sidewalks, as a winter runner, that's a big deal.
Right.
You want to make sure that you have the ability to walk outside, even in this inclement weather. But everybody has a piece of that. And also working, with businesses, we can say, how do we create a healthier workplace for your employees? And a lot of that can be done at a very cost-efficient, low budget. Just what are you offering in the business for, say, beverages or snacks?
Now, you can look around and go to any business, and they're going to have candy machines, pop machines right in their place of business. I'm not saying those are bad things. Don't misunderstand me. But there are alternative choices that can be put in those machines, correct?
Absolutely. Yes. And we've just recently, as of October 1st, CentraCare Health whole system went sugar-sweetened beverage free. And we had a great working relationship with both of our vendors to make sure that we had those better for you alternatives. So it was a win-win for both of the vendors and for us, and then for our patients, our families, and our employees.
We hear the term population health, overall population health.
Yes.
That sounds really big and kind of out there. That
nebulous.
You might hear a political candidate say something like that, right? So what does that mean? Population health, is that right here in central Minnesota, or does it kind of expand?
Yeah, that's a great question. And we look at it in two different ways. So we have populations within our patient population, say high-risk diabetics or people who are pre-diabetic. Okay. And we want to look at that population and how do we treat them differently? What are we doing so that we can manage their care? And we also want to look at whole populations, zip codes, for instance, okay, and say, what are we doing in this area so that we can prevent them from becoming pre-diabetic or diabetic? Do
you use those zip codes and sectors of a particular part of the country as saying, oh, there's a higher incidence of childhood obesity,
yes,
and here in this part and over here they're just hypertension or what have you?
Yeah, and the wonderful thing about CentraCare having such a large footprint and being the leading health system in this area is our electronic health records are very rich in data. So we can take census data and our health data, and you can just look at Sauk Rapids, St. Joe, St. Cloud, and Waite Park. And there's great discrepancies just in those populations and in those zip codes.
But wait until you check out 56283, which is the zip code for Redwood Falls, right? Because you guys are now down
Absolutely.
That far southwest.
Yep. We are going all the way out to Redwood Falls to the west and all the way down to Monticello to the south. So we're continually growing our footprint.
It's interesting because I bet you'll be taking some of that information from those people, agricultural, highly ag businesses, right? And you can compare what's going on in southwest Minnesota, Willmar, south central Minnesota, all that stuff.
Right. And each community is different in many aspects, and it's what their community offerings are, too. We can't expect that we're going to have one, quote, pill that's going to be, the answer for everybody.
The magic bullet, right?
Right, exactly. You're going to have to look at what are the populations, what's the culture, what's the history, and then work within those communities. I think we've historically said we're going to do to, not do with, and we really need to do with, and what really resonates with the population in those communities.
I think what you just said is one size does not fit all.
No, it does not.
Right, folks down in southwest Minnesota, my hometown, Redwood Falls, Bellevue, around there, may have completely different health concerns than we do here in St. Cloud.
Yes, absolutely.
Very good. But yet you can still customize plans that those people would use.
Right, absolutely. And again, having conversations. We've done some work with the 56304 zip code, which is on this side, the east side of St. Cloud. And what we had anticipated would be that population's greatest concerns are not. They're really concerned about transportation and access to food. Yes. And so here's again where we would have come in like, we have all your answers. And they wouldn't have been applicable to the population.
But those aren't our questions.
No, exactly.
Wow.
So instead, listening can really benefit you quite a bit.
Jodi Gertken is our guest. Jodi is the Community Wellness Program Director for CentraCare. And again, folks, this is brand new on KNSI. It's called Your Health. And it's so important that these folks that we're going to be talking with are local health experts, again, because they are experiencing the same things that you are right here in the Granite City, central Minnesota, right? You know these people, you see them at work, you see them at play, They just happen to be healthcare professionals at CentraCare. So this is the first of many conversations that we will be having about you and your health on KNSI. AM 1450, FM 99.3 KNSI. We are back, our final installment of a brand new program here on KNSI called Your Health. It is brought to you by CentraCare, and these folks are local healthcare professionals, right? You know these people. They just happen to work at CentraCare. They're impacted by the same things that affect you and your family, the flu, all of that stuff, right? Jodi Gertken is the Community Wellness Program Director. Jodi, I mentioned the flu. Has the flu hit your house yet?
No, wrap on everything.
Yeah, exactly. Well, I bet you got your flu shot, right?
Why, yes, we did get our flu shots, yes.
And this year's vaccine was spot on against the H1N1. The formula was perfect.
Well, so far, so good.
Apparently,
yeah,
it's working. I wanted to kind of dovetail on the end of our last conversation. We were talking about population health. I know that there are certain ethnicities that have certain health-related problems. You would almost assume they were predispositions, almost, wouldn't you?
Oh, yes.
Genetic codes,
yes,
what have
absolutely.
you.
Yep.
But by the same token, you have folks at CentraCare that are of those same ethnicities that know what they're talking about because they are experiencing maybe those same health issues firsthand.
Absolutely. I think one of the aha moments, not only for CentraCare, but for the state of Minnesota, when we were reporting some of our measures that we're required to do annually, we would say, well, look at that. We are screening at an above average rate for breast cancer.
Sure.
Our colon cancer rates are, again, above average. And then we would dice it down a little bit and say, oh, wow, yeah, for the Caucasian population, we're really hitting those measures.
Right.
But whoa, when we're looking at our Somali population, our East African, we're not meeting those measures at all. So what are we going to do differently to, again, engage those populations
right.
and get those screenings up? And then likewise, look at some of the dietary things. If we're dealing with a group of diabetics and we're teaching them to cook what we would naturally assume is like a central Minnesota healthy dinner.
Right.
That's not everybody's, palate.
Right.
So we need to look at what are the foods you're using and what are some substitutes we can make to make those meals better for you.
Absolutely. And all of this information is found at CentraCare's website?
Yes. And if you can't, I would go to CentraCare.com and there's a plethora, probably more information than you
Sure.
need, but you'll find somebody who you can talk to.
And we're going to be dissecting that website in a future program.
Yes.
Because there will be so many different places we can go.
Yes.
All
And
right.
and we are actually updating that. So timing is perfect.
All right. I wanted to ask you about some of the other things that CentraCare does. And all you have to do is look at your calendar of things that are going on, right? CentraCare is involved in so many things. For example, the Earth Day Run.
Yeah, it's coming up. I know it sounds unusual with all this snow, but one day we will be running warm in the nice outside weather. This is something that CentraCare has been participating in for possibly a decade. When you talked about Blend and some of the things that we did with the Kids Expo, then we started doing the Kids 1K run, and then that just kind of morphed and evolved. And at one point in 2016, we actually started organizing the event, which has been very successful for us. This year, the 20th anniversary, we are moving it from St. Cloud State University to downtown St. Cloud. Mm-hmm. So we're really hoping that this is going to be bringing us to that next level of participation and engagement. We have the premier Central Minnesota Health and Wellness Expo, which is open to everybody. So you don't have to be participating or running. You can come down on Friday and partake in all of the events that we have going on.
You have also teamed up with a local area YMCA on a lot of events, right? So think about this, whether it be Thanksgiving or Christmas or whatever, there is usually some type of fun run that's involved. And we talk about expanding a footprint of good health. The people that come home to visit their friends and family here in St. Cloud do this, and then they take it to their community and say, hey, you know what? They do this in St. Cloud. You should do this here.
It's ironic that you mentioned Thanksgiving because this year's Earth Day Run events does happen to take place on Easter weekend.
Nice.
So if you're going to be in town for that or have relatives coming in town, again, the 5K and 1K will take place on the 19th, which is Friday, and then we have the half marathon and half marathon relay.
Jodi, from your personal experience as a runner, and the community of runners just keeps getting bigger and bigger and bigger, doesn't it?
Well, I think there's more opportunity now. So you don't want to do a half marathon. 13.1 is too much. You can pick a friend and you can each do half. And maybe that's where you want to go. Or you don't have to run. You can participate in the 5K and you can walk. So there's a lot of different elements to that where it's not just about the run. It's also about the camaraderie. It's about getting out. It could be about volunteering. Earth Day would not be able to do what it does without the volunteers.
It could be about parks and rec. When you have a new facility, a new part in town that is being developed and there has to be green space, think about these types of things. And it's all part and parcel of every community in central Minnesota. It's all part of their footprint, all part of their plan for development.
Absolutely. We've worked with the City of St. Cloud, St. Joe, and Sartell on their comprehensive plans, which is something a healthcare system historically wouldn't do. So these are new partnerships, again, that we're creating to think about the future of the greater St. Cloud area.
A lot more than just a walking path, that's for sure.
Absolutely.
Jodi, thank you so much for stopping in today and for being our first victim. No, for being our first guest.
Thank you.
You've been listening to Your Health, AM 1450, FM 99.3, KNSI, Community Wellness Program Director for CentraCare, Jodi Gertken. Remember, this program airs Saturday afternoon at 2:30 and again Sunday morning at 9:30. Thanks to CentraCare. It's Your Health on KNSI.